And all those things. Just saying. So, I think I'm shorter than almost anybody here.
You can just take it on out.
Yeah, well, but I'm also really, really loud, so I probably don't need the microphone, but you know, that's where I am. So, hi.
Hi. Whoa.
I'm Michelle Oberson. I'm an MD. At almost any gathering, I'm almost usually the oldest person. I'm sure I'm in my office, but I've been in practice over 25 years. I trained at IU, which is a public school. I'm the daughter of a public educator. My father taught in Warren Township for 38 years, junior high. I think you need a medal. I went to a private undergraduate school, but I did go to the Indiana University School of Medicine, so I am publicly educated. I trained in family practice at Methodist, graduated from there in 1991, and I practiced in Brownsburg for quite a few years, traditional family practice. Now I treat opioid addiction, and I love it. It is the most rewarding thing I've ever done in my life. So, that's me. I have 4 daughters. And so I want to talk a little bit about the Affordable Care Act. And various other things. My daughter, my third daughter says that I might be the only Democrat in Pittsburgh. But anyway, that's right, somebody's got to do it, thank you. Okay. Early in my career, I got a shocking revelation about the insurance and Medicaid in the state here, because one of the guys who trained in my residency class with me moved to Corridon to take over his dad's practice. His father, unfortunately, passed away shortly after that, but he and his wife had a baby that had special needs. She had a chromosomal anomaly. It wasn't Down syndrome, but something else. And in Indiana, children like that were not or covered by Medicaid automatically. They could not buy insurance for love nor money, even though he was a rich doctor, and they had to sell the practice and move to Kentucky because they couldn't get coverage for their daughter. Insurance companies don't really care about your sad story. And a lot of the problems with the Affordable Care Act are due to the fact that the insurance companies are being forced to cover things they don't want to cover. When I first went into practice in 1991, it was very unusual to find an insurance plan that covered things like addiction care and mental health and those type of things. So, let's go back here. These statistics I have here are from a nonprofit organization called Shatterproof. If you have a family, this is new, I don't know a lot about them, so I'm not really pushing them, but it's an interesting organization. So if you have a family that you know that has been touched by addiction, and who of us does not, unfortunately. But this is from their website. If the Affordable Care Act is repealed, researchers estimate that more than 4 million Americans will lose access to addiction treatment. And I believe that. I think that number might be low. We have a great number of patients who receive care, not necessarily their care, but certainly coverage for their medications through the HIP plan, which is Pence's idea of the Medicaid expansion. I love when people go, well, Indiana took the Medicaid expansion. It's not the same. These patients have to pay, and for instance, my daughter who has crippling student loans, this is my first daughter, I have to specify, was going to have to pay $400 a month for her insurance with her $10 an hour job because she happens to live in my house. So, anyway, 4 million Americans will lose access to addiction treatment. The number you hear bandied about now is 20 million Americans will lose their insurance coverage. So, there's also that little problem of the insurance companies decided that you had a maximum amount that they would pay for you for a year, or a lifetime maximum. So you could get a call when you were on your 4th round of chemotherapy for breast cancer, and it would be someone calling from Anthem saying, or Anthem Signet, I'm not signaling at anyone, saying, "We're sorry, but we've spent enough money on you and you have no insurance." I have read statistics, although I can't give you a number, of the number of personal bankruptcies that were filed only because of medical bills before the Affordable Care Act, and that is heartbreaking. Okay, now, so the Affordable Care Act, let me find my thing. I found a list that listed 10 pros and 10 cons of the Affordable Care Act. Make no mistake, the Affordable Care Act and Obamacare are the same thing. They found when they were trying to sign people up that people didn't want to sign up for Obamacare. But if they wanted to sign them up for insurance for the first time in their life and they called it the Affordable Care Act, they would do that. And they would say, "Thank God I'm not on that Obamacare."
We wouldn't even be talking about it if they hadn't called it Obama. We wouldn't even be talking about it.
I saw a great sign the other day. Someone at a rally had a sign that said, "It's called Obamacare because Obamacare."
The Republicans invented that because they wanted to smear people with it. They wanted to hang it on it
Absolutely.
and pull around to say.
Absolutely. So the pros, I have 10 pros. It lowered overall health care costs by insuring millions and giving preventive care for free because it's much better to prevent something than to treat it. It required all insurances to cover 10 essential benefits, including mental health, addiction care, chronic diseases, maternity care, inpatient prescription medicines, rehabilitation like after an injury, preventive care, and pediatric like dental and vision for kids. Number 3, it must cover pre-existing conditions and can't drop you or raise your premium if you get sick. Number 4, eliminates lifetime and annual coverage limits. We talked about that. Number 5, your children can stay on your plan until they're 26. For me, that was a lifesaver for my kids. Number 5, wait, I got that. 6, the states could set up exchanges or use the federal exchange, which made it easier for people to shop for insurance, depending on how your state did things. Like I said, and rumor has it now that the person from Rokita's office, if you go to his website, on the left side, there's a list of the things that he's done. Someone from our state has now gone to the federal government, and the rumor has it that the reason that has happened is because Pence wants to set up something like HIP in the federal government for everyone. And that's what they're talking about doing for when they repeal the Affordable Care Act. Okay. Anyone below 400% of the poverty level gets tax credits to help with their premiums. Supposedly increased Medicaid to 138% of the federal poverty level, and allowed adults with children to sign up for Medicaid. Again, depending on your state. Does anybody know what the Medicare donut hole is? I'm sure some of you old folks do, but yeah, that was and with disabled youngsters, that's where you get to, it's at the end of the year, yes? Was it the end of the year? You get to the end of the year and you've spent all the money.
Wherever you're out of pocket, or
Right.
even you're out of pocket, your whole total cost, it's a certain amount.
A certain amount, and then you have to pay for your medications. So we would get to a point in my family practice, my primary care, where, and it's different for everyone, where they would hit the donut hole and then all of a sudden they couldn't afford their medications anymore. Because make no mistake, people in America pay 3 and 4 and 10 times more for medications than people in Canada or other countries. So, businesses with more than 50 employees were supposed to get tax credits to help with the requirement that they offer insurance. no matter what you hear them say, the budget deficit is actually decreased by $143 billion with a B dollars by 2022. And that is because the government health care cost goes down because of the preventive care and all that. And there's an increased tax on some businesses and higher income people over $200,000 to $250,000 had to pay a small increase in tax, not small to them. And a change in cost to providers and pharmacies. Okay, so those were the good things about it. A lot of these things that are bad, it looks like, are really things that have to do with the insurance companies. You know, President Obama said, you can keep your plan if you want to. Well, a lot of the plans, they had to drop them because they didn't cover those 10 things. Or the price went up because the insurance companies realized they weren't going to make a huge profit, so they passed that along to other people. So there was a lot, you know, there's a lot of and people didn't like that they had to pay a penalty if they didn't get insurance. Well, you know, the whole point of insurance is everybody pays some, and so the younger, healthier people didn't want to pay any because they're young and healthy.
Buy your car insurance.
Exactly.
I'll drive my car insurance right now.
Right? So, anyway, so I have I won't worry with going through the whole thing. I mean, there are drawbacks, I will give you that. But I agree with everyone else here. They always intended to tweak this and make it better. So I'm of the single payer would be best. You know, there is no reason that 30% of our healthcare dollars do not buy healthcare. They go to insurance company profits, and that's obscene.